NCD Alliance of Malaysia. And I'm very quickly going to run through this process that we put together to build a 3-year strategy for the Alliance. NCD Malaysia is a combination of 15 different organizations working in different areas of NCDs, including cancer, of course, and cardiovascular disease and diabetes and everything else. So it's really a combination of patient advocacy and support organizations with a local member or affiliate, whatever we call it, of the Global NCD Alliance. That's my COIs, and I'm just going to swing right into it. Okay, so usually when we develop a strategy, and most of y'all may have seen this, we get a couple of people closely sitting down in a closed room, dark, and then and we kind of put up a strategy. So this time we decided, look, we want to represent our clients. And our clients are actually the patients, the people living with NCDs that we work for. So we kind of leveraged on an earlier project in which we did a data collection and built this robust global advocacy agenda as part of the NCD Alliance. And it's got data from about 600 over people collected across the entire country, different people living with NCDs, very heterogeneous data collected in 4 different languages across different NCDs, across different geographical regions as well. And so we kind of leveraged on the idea of the Global NCD Alliance's 4 pillars of prevention, treatment, care support, involvement, and human rights and social justice, and the kind of channels in which they work to kind of push advocacy and supporting people living with NCDs. Now, what we then use this data for is to kind of gather up these asks to different categories of stakeholders, government, people's representatives, politicians, ministries of health. And this data we subsequently took back to our alliance, to individual organizations, and as well as in separate, like, kind of cohesive discussions with the alliance as a whole. So individual organizations prioritize the asks of people living with NCDs according to different categories of stakeholders, and they then decided as individual organizations how much of resources they would be willing to commit to it over a 3-year period. It's kind of contractual in the sense of we decided to put them to force commitment on paper to what they would commit to doing over a 3-year time for those organizations. Then we came together as a whole, as an alliance, and put together a document with a strategy and timelines on specific objectives that the alliance wanted to do as a whole, how we were going to carry out those objectives, and the kind of resources which each individual organization would then commit, as well as the timeline which we'd commit to doing it. So yeah, you've got then this very pretty looking document which comes back to fulfilling what our clients want, which is what is the end of the day. So learnings, what we managed to do is, one, for different organizations, it's also a very engaging process for them to get into action with their own members, but as well as it's an important network building and alliance building strategy for the alliance as a whole. So of course I need to advertise this. There's a little card going around. You can scan and look at the entire document if you want, and then you can always speak to us. Thank you very much.